Good evening, and welcome to another edition of the Rankin Mon Valley Pittsburgh section of the National Council of Negro Women. My name is Patricia Blewett, and I am our section's corresponding secretary. Joining me this evening is Alice Paylor Days, and she is a member of our section's political committee. We thank all of you who have participated in previous programs, and we hope that you will join us again this evening by calling 412 953 9583. That number will remain at the bottom of the screen, so if you need to give us a call. This program, our special guest today is Dr. William Simmons, who will help us to discuss the COVID-19 virus, the variances, and the vaccination. This program satisfies two of our national mandates to disseminate information about issues affecting African American women and their families, as well as promote healthy lifestyles and behaviors through wellness projects. It also satisfies one of our Four for the Future initiatives, which is to continue National Council of Negro Women's historical focus on health concerns in the African American community.
Evening. Good evening. Dr. William Simmons, MD, is an associate professor at the University of Pittsburgh School of Medicine. He is originally from the state of South Carolina and was the first in his family to attend college and medical school and also study abroad. Dr. Simmons earned his BA at Carleton College in Northfield, Minnesota. He was the only African-American male involved in the third ever Mayo Clinic Medical School graduating class. He was the first Black chief resident in pediatrics at Georgetown University Hospital. Throughout his career, he has been a leader and a groundbreaker in the medical field. This year, Dr. Simmons was chosen by the New Pittsburgh Courier as one of the Men of Excellence, which is awarded to those who exemplify strength by standing firm in the face of adversity, leadership in periods of struggle, compassion in times of peril, and integrity in the midst of opposition. Welcome, Dr. Simmons. We thank you for appearing on our program this evening, and we'd like for you to give us a brief history of why so many African Americans are hesitant about getting the vaccination. Because COVID-19 is such an unpredictable and devastating virus. Why are we so hesitant about getting the vaccination?
Okay, well, thank you very much for having me be a part of your programs and and be a part of the mandates that you're trying to do for the community. I am also a board member of Gateway Medical Society. And we are, there are two different medical societies in town. There's the Gateway Medical Society and the Allegheny Medical Society. The Gateway Medical Society is a part of the NMA, which is the Black Medical Society in the United States, and the other Allegheny Medical Society is a part of the American Medical Society. We are a organization who is committed to educating the community, and that's why I so gladly accept your invitation here. And so one of the things that I wanted to talk a little bit about is that since you mentioned that people are sometimes hesitant about this, I wanted, and they mentioned things about historic things. I just wanted to spend a brief time just kind of touching on a few of those things. and I have to go back to where we first had an incident where medical physicians and medical problems affected African Americans adversely. In 1721, there was a smallpox epidemic that spread from the ships that landed in Boston from South America. And that caused a major outbreak in the Boston area. That is the first use of a vaccine in the United States was this 1721 by Dr. Mather. And the reason that he started doing this was that one of his slaves, and I wanted to let you know that even though people were slaves, that didn't mean they were ignorant. This man came and told his owner, saying that when these kinds of problems happened in his country, he's talking about Africa, he said they would give small aliquots of the affecting agent to the people, and they'd get mildly sick, but it would stop them from getting very sick. And so what he did was that he found he isolated the smallpox and gave it to a group of his slaves first. So African Americans actually were the first persons to ever get a vaccine in the United States. And he did that. So it was done without their consent, but in any case, they were among the first. The slave actually in the Boston newspaper was given credit for his information that he gave, and that was in the newspaper in Boston, saying that he was for stopping or affecting decreasing the effect of the epidemic that was in Boston at the time. The second major medical problem or medical issue that brings some people concern was Dr. James Myron Sims. Dr. Sims is touted as the father of gynecological surgery. The problem that happened for him was that in the 1800s, he would practice his surgery, the new techniques that he was learning, on African or his slaves without anesthesia. And then after he perfected it, he would do it on white women with anesthesia. And so this was, and again, this was another situation where people were, medical techniques were done on African Americans without their consent. All of these things just piled up and caused people to be weary about doctors in general, and also, it kind of adds to skepticism. Margaret Sanger, who is known for her abortion clinics that she has, Margaret Sanger was a major portion of a movement called the Eugenics Crusade. And Eugenics Crusade was trying to get a pure white race, and trying to make sure that there wasn't intermarrying and there wasn't, and so she wanted to, and they was also trying to, by doing this, by decreasing the number of African Americans that was available. So she did it by abortions. So if you notice that most of these clinics that she is a part of was always right adjacent to Black and brown people's neighborhoods. You never find them near a neighborhood. It was intentionally built in that way to encourage abortion and that was her way of trying to be involved in some of the forced sterilization and so forth that was being done. In the 1930s and 1940s, there was something that was going on called the Mississippi appendectomy. The Mississippi appendectomy was an involuntary sterilization of poor Black women and people who might have been impaired mentally and so forth. But they would go in for an appendix, and inadvertently, or actually very planned, they got their uteruses taken out at the same time without their knowledge. And so this was a major problem in the South, and there were many different states that practiced this type of thing. But Mississippi was one of the major places. That's why it even got the name of Mississippi appendectomy. Now, when I grew up, there was something called the boogeyman. And my mother and my grandmother would always never let me go out at night because she says a boogeyman would get you. Well, the thing is, I just grew and blew that off, saying that there's no such thing as boogeyman. But I actually found out that there was a boogeyman. And it turns out that they are called night doctors. The thing was, during the end of the Civil War, when these hospitals, the major hospitals in the country, the Georgetowns, they needed to have cadavers so that your students could do their work. And there wasn't enough. So they would hire people called night doctors or boogeymans that would go and rob fresh graves of Black people and get their corpses and sell them to these major medical centers. Well, the Black people were getting knowledgeable about the fact that this was going on. So they started putting metal grates over the top of their graves so that nobody could get in. Well, then that's where the boogeyman part of it starts out, because if you were a Black person that was walking on the street or aside the road by yourself and one of these guys would come by, no one would ever see you again. They would be snatching people right off the streets. And then all of a sudden, Georgetown or one of these other places that was buying them would get a new cadaver. And so that was a major thing that went on for a long time. Of course, everyone knows about the Tuskegee experiment. That was during World War II. World War II, the men were coming back and they had a major problem with syphilis and gonorrhea, which they got in World War II in the European theater and also in the Italian theater. And they would come back, and there was no real treatment for it at the time. And so, except for there was they use mercury and various other drugs, but it took a long time for the treatment. So there were so many soldiers that were affected that there would be almost a battalion that was in hospitals for 6 months or a year trying to recuperate from having this problem. So this study that was done was trying to find out how the course of gonorrhea and syphilis would happen. So they took these Black men and they tried to say, we were going to treat you, but they actually did just the opposite. They didn't treat them at all. And what they did was to follow them. But the thing is, they continued to have wives. They they had kids and so forth. So actually, it became the amount of the syphilis became affected their wives. They affected their kids, and for generations. And so they went on until in the 60s before this particular experiment had stopped. That wasn't the only thing that these people were doing. They didn't get enough studies done with the Blacks in the Tuskegee experiment, so they went to Terre Haute Prison in Indiana, and they tried to give syphilis to some of the prisoners so that they can study them. But they found out that just giving it to them wasn't enough. It didn't work very well, so they needed to have the natural process, meaning that they needed to have women do that, and that wasn't possible there. So they found out that indeed in Guatemala, where prostitution was legal, this team went to Guatemala and started saying that they were going to help the women and and do some free examinations on these women. And when they found ones that were that had gonorrhea or syphilis, they would send them to the prison system so that they can get as many men covered or inoculated as possible. So they were doing this in not only in the United States with Tuskegee, not only in Indiana at the prison system, they actually went to another country, to Guatemala, and did the same thing during the time of this one particular Surgeon General that allowed it. And he is someone that actually became a dean at the University of Pittsburgh later on. And so in any case, so those are the kinds of things that has been that some people may remember that's going on, that indeed there are many situations where Black people have had their rights and things done to them without their consent. And so the last one that I want to speak to is a lady named Henrietta Lacks. And Henrietta Lacks, in 1951, she was 31 years old, and she had an aggressive cervical cancer. She went to Johns Hopkins to have it evaluated. They biopsied it, took some of the cells, and then later on, within a year, she died. But those cells kept living on and on, and so they used it in experiments. And then all of a sudden, they were so good that other companies wanted to use it. And so around the world, they have been using the Henrietta Lacks cell, and they call it HeLax, or short for Henrietta Lacks. Their HeLax cells have been used by industry throughout the world, earning billions of dollars. But Henrietta Lacks' family never got any of that until a lawsuit came about just recently to try to rectify some of that for them. So in any case, African Americans have a lot of issues that we have to tie in here. And I just want to transition here and tell you that as far as when you look at prostate cancer, we're number one death of prostate cancer. Colorectal cancer, African Americans are number one death. Diabetes, we have the highest death rate associated with that. HIV, overwhelmingly the highest death rate associated with that. Heart disease, cancers of all kinds, and then and then in the category of breast cancer, this is where we start talking about some disparities in medicine. In the category of breast cancer, white women has the highest incidence of breast cancer, whereas Black women has the highest death rate. And so you say, why is that? Well, if you don't have good medical coverage, if you don't have the ability to or a doctor that you can go to see reliably, you might not go in when you start seeing a little bit of changes here and there. And many Black women came in after this cancer had started to spread to areas where it wasn't effective to try to get the appropriate treatment. So in any case, that would be one of the things. So in any case, those are the kinds of, those are some of the things that I wanted to just mention that have gone on, that have caused some people anyway to be suspicious of medical people and suspicious in regards to their intentions as regards to African Americans. And because there are so many circumstances, those that I mentioned, and even others, where African Americans have been used without their consent for experimental purposes. So, so now that we have just kind of opened that, we need to now talk about this circumstances. And I want to actually start off by letting people know, even though I talked about all these other things, that COVID-19 is real. This is a real problem. This is a real thing that can cause injury and illness and even death. And it has been causing a significant amount of death to the African American population. And one of the reasons that it can cause a lot of death is that we have a lot of coexisting diseases that have caused us to have our immune system impaired. Diabetes being one, heart disease. We have consequences of diabetes like vascular disease, and we have lung disease that from just asthma to consequences of COPD from smoking and all of these things. We have many, many things that have caused us to be impaired, which means that our immune system is not robust enough to protect us when we are being attacked by an adversary like COVID-19. And so that is one of the things that I wanted to make sure that you understand, even though I told you about these other things. This is a real problem. And because of that, you need to learn or do something to protect yourself, to fortify your immune system. If you are of those, and I have family members as well, even though I've talked to them many times, that have refused to take the shot. I have tried everything I can to try to get them to do that, and they still refuse. But I still get them to try to fortify their immune system, because African Americans tend to have a decreased immune system secondary to poor diet, secondary to some of the coexisting diseases and so forth. We need to do something. It's not just a matter of, oh, I refuse to take the shot and do nothing. You need to figure out how you can fortify yourself, how you can improve your immune system so that you can indeed stave off some of the consequences of this particular virus.
Okay. Well, thank you. That was very interesting. If you want to call in and ask a question, don't forget the numbers at the bottom of the screen, 412-953-9583. Dr. Simmons, I have a question. It's a multi-part question, and I'll ask it and then you can answer it the best way you want to, okay? What information can you share with us about the Delta variant and the Omicron variant? What are the symptoms? Who is most likely to be affected by these variants? And are they deadly? Are they more deadly than the original COVID-19, or are they more contagious?
Now, when you're talking about the COVID is a virus, and these viruses have proteins that are on the surface of them. As these viruses go through the body and get exposed to different things, they tend to mutate or change in one way or another. There are some changes that can be not nearly as devastating as the original, but then there are some changes that can make them at least easier or more aggressive as far as getting infected and having more devastating effects and so forth. Now, the original COVID-19, which started in the late 2019 and then the 2020 timeframe, followed. And the thing is, don't think that Delta was the next one. There were other different kinds that may not have affected us very much in this country, but they are other types and variations of the virus that might have affected Europe and might have affected in Africa, that might have affected in China or India and so forth. But the ones of concern that came to the United States is the Delta version. Now, the symptoms that we can, the original one had a lot of pulmonary associated disease, And on the X-ray, if you got to the point where you needed one, it was like ground glass in appearance on the chest X-ray. The reason was that it it affected your immune system in such a way that you started attacking yourself. You started attacking your own lungs. You start attacking your own organs. And it's not just the lungs, but it can. Some people started off with COVID, and then afterwards they're on oxygen. They can't breathe as well, or they have diabetes and they didn't have it before, and they have that. So they might have renal problems. They might have heart problems. There are some people that have that have had that may have not been healthy and so forth, and then all of a sudden they've had some kind of a viral myocarditis. They have problems with their heart where they don't have the energy that they used to have. And then there are some people that have brain fog. They used to be really smart and can think of things. Now they can't even find their car keys. So I'm not saying that is a main problem, but I'm just saying that is something that we have seen now. And so Delta, on the other hand, was able to affect a lot of people in many countries, and the southern part of the United States was dramatically affected by Delta, and a lot of people died in the process of having exposure to Delta. And so as far as they had pulmonary problems, but they also had the cold, they had headaches, they sometimes they can even have visual impairment. There are all kinds of symptoms that might manifest. Delta and the original was somewhat similar. Now,
Dr. Simmons, we have a caller on the line.
Okay.
Her name is Lauren. Would you like to take her call, please?
Please.
Hello, Lauren. Welcome to our program. Hi.
Hi, thank you. First of all, I want to say this is an excellent show. I just have to say that. Dr. Simmons, you've been just great thus far, and I really appreciate the show and the information you've shared. First, I'd like to tell you my experience. I was totally against getting the vaccine, even though I had, issues and health issues that would make me prime candidate, go get it. I finally got the shot when a friend of mine contracted COVID, and I ended up with COVID arm, which I wasn't familiar with, and I thought I had studied pretty well. That was one issue. So I got COVID arm. Now I have to get my third shot, and I'm thinking of switching from Pfizer and get my booster as Moderna. So I'm gonna hang up. I'm gonna ask you these questions. I'm gonna hang up so I can hear your answer. I was wondering if that is wise to get the Moderna shot after having 2 Pfizer previous shots, vaccines. And then I had a question. When people are being tested for COVID-19, I don't understand at any time why they are still using the swab that goes toward the tip of your nostril instead of going all the way up your nostril cavity. That would give a better result. I know it may take longer, but it lessens the chance of someone continuing to go out in the community and their families and spread it. That's number 2. Number 3, my thought is, because this disease or virus is so hit and miss and deadly, I don't understand why there's not more of a mandate on wearing a mask or the shot. I think that's where confusion gets in a lot of time for everyday people. We're not terrorists. I'm not a conspiracy theorist, even though I know what we've been through in America. However, I believe in science, but I don't understand if it's that deadly, we're not taking the time as a community of people in the world, in America, to shut it down, wear your mask, make it a mandate, get the shot if necessary, and move forward. Those are the 3 major things that I wanted to say. And I just have a comment, because I think African Americans do have a reason to be suspicious about the government for the reasons you stated. But I often wonder why the white Americans aren't getting the shot. Thank you, sir. And I'll listen. And ladies, you are doing a fabulous job. Thank you. I'm going to hang up and listen. Thank you.
Okay, the first one that you were asking about is that can you switch from one type of the vaccine to another? They actually discourage that. Even though both the Moderna and the Pfizer are what is called mRNA, which are they are packets of information that is being carried into your cell, and that packet of information, once it gets into the nucleus of the cell, will actually go and create proteins. The proteins that they create are similar to the proteins that's on the surface of the coronavirus, COVID-19. And so because it's similar, then it will start creating antibodies to those proteins, which would be similar to the ones that are on the original COVID-19. That is one of the problems. As you get different variations of the variants of the coronavirus, they can tend to have a difference in the makeup, the difference in what the surface proteins are like. And so you may tend to have a decreased effectiveness of the vaccines, because the next generation, the Delta was different from the original one in some ways. So the percentage, they initially say it's 95% effective in decreasing the severity of disease. Well, Delta wasn't exactly 95%. It was much lower percentage. And then this Omicron is the people who are studying that saying that this particular thing is completely different looking than the other ones. And so their proteins that are on the surface is so different that they are concerned that this might not be as effective or not effective with the vaccine nearly as much as any of the others. So every time there is a change in the virus, unless they are planning to create modifications in the vaccine, that vaccine may not be as effective in the long run as it was to the first version of the virus. Now, you were talking about putting in the nostril and using that what is called polymerase chain reaction, that PCR exam, when they put it in the nose. The virus sits very deep in the nose. So that's why when they were initially trying to do it, they put it very, very far back and tried to get as much of the sample as possible. Just going to the more distal area of the nose, that's not where the virus usually sits. So the effectiveness of the exam might not be as good. And that's why they have wanted to do that. Now, even though they tell you that as far as this polymerase chain reaction, that PCR exam is more, testing is better. There has been some problems with the PCR exam in the sense that its effectiveness, it heats up the viral material and actually duplicates it, and they go through cycles, and there are 20 or 22 cycles actually gives you about 85% effectiveness. The problem is that when we started doing it at COVID, the government mandated that they go through 40 cycles, and that 40 cycles actually increased the amount of false positives. So a lot of people who were getting the test were being said that they were positive, may not have been positive, but we can't say that for sure. We all know that, but right now you find out that the government is changing the PCR test to go back down to where it is most effective, because a lot of people were having problems with getting false positives. Now, as far as mandates, a lot of people don't like to be mandated to do one thing or another. It is oftentimes better to try to explain to them what the importance is, and getting them to accept, especially in the African American community and so forth, trying to tell them you have to do this or that. You find out that people can be very, very resistant to that sort of thing. So I basically try to give information. I try to try to educate people, and by doing that, hopefully they would see the virtue or the value of doing something and trying to get the shot to protect themselves, or using some other modality to protect themselves, not just doing nothing. The other modality is trying to increase your immune system with vitamins and minerals. They are very, very good to increase. I'm not saying that they treat COVID. I'm trying to say that they increase your immune system so that you can help fight it off yourself. So by doing something like that, so on a person who is definitely opposed to taking the shot, they need to find ways of increasing their own immune system so that they can be fully protected. Now, as far as
Dr. Simmons, we have another caller on the line for you.
Okay.
Her name is
And
Valerie.
So the last part was about whites versus blacks. Nobody likes to be told what to do, and that's why many, especially many people don't tend to want to wear the mask and so forth. But wearing the mask is going to be your first line of protection. Washing your hands is going to be very important, and trying to stay away of crowds and so forth. All of these things are still very valuable and very important, in addition to getting a vaccination or in addition to using them. Yes, ma'am. Who's on the line?
Okay, we have Valerie on the line for you. Hello, Valerie. How are you?
Hello, NCNW. Great program as usual. And Dr. Sims, thank you for the informative information. My questions are as follows. I am fully vaccinated and I have no symptoms, but I keep hearing that people are being positively, even though that they have had their vaccination. Can you hear me? I see you.
Yes, I can.
All right. And then kind of a secondary question. When can I travel safely in the United States, or should I travel safely to visit family and friends or just have fun at this point? And you mentioned about being fortified. Is that the vitamins and minerals that you were referring to, or is there a process that I can take? I know it's exercise, fruits, vegetables, and things of that nature. I'm going to hang up now. Thank you so much. I'll wait for your response.
In regards to your first question about you have to, people have been misunderstanding the information that had been said when they say that the vaccine is 95% effective. They were saying 95% effective in decreasing the severity of disease. They didn't say that you wouldn't get it. It just means that you might have a lesser course. You won't get nearly as sick. And it's unlikely that you're going to die if you've had the vaccine, because it will give you a lesser course. So people who have had two vaccine shots and their booster can still get COVID. People who've had 2 vaccine shots and their booster can still spread it to other people. It's not that it is unlikely that you're going to have a bad consequences if you get it, but it doesn't mean that it's not like they're putting up a shield so you never get COVID. You can still get it, but it just won't be as severe. Now, as far as travel, you have to continue to be very careful. There are some parts of the United States that might have more significant infiltration of COVID. Like, take for instance, last summer, Florida was a hot spot, and people who wanted to go to Florida found themselves in a bad situation because the hospitals were filled. And so if you go someplace and you get a COVID and you need to go to the hospital, you may find that you don't have the access, you don't have the ability. So being very careful to make sure that you're wearing your mask, that you're washing, that you're using social distancing, and all of those things, regardless of where you go, is going to be very, very important to you. Even though you've gotten all of the vaccines and you've gotten all of that stuff, you still need to be very careful. And I might add, you still need to make sure that you take your vitamins. One of the vitamin that is very, very important to your immune system is vitamin D. And unfortunately, because African Americans have a built-in deflector of sunlight, we have dark skin, and that dark skin decreases the amount of vitamin D that we can make in our skin, make through our skin. So the amount of vitamin D that people talk about as being effective in making sure that you have a fortified immune system is like 50 to 60 millimoles per liter of vitamin D in your system. The problem is most African American have about 5 to 10. And because they have so limited and so low amount of vitamin D, that has been one of the things that some researchers have found to be a deciding factor of when they get COVID and they have to go to the hospital, they get a very, very sick and very bad course of this because their immune system is not up to par and they're not able to fight off this. Plus, they might have coexisting disease like diabetes and heart disease and all of these other things, which too can be affected by lack of appropriate vitamins in your system. So, even though you have all of your shots, you still need to take your vitamins, and you still need to fortify your immune system to protect yourself. So, traveling I'm not going to say no to that because I'm traveling tomorrow. And I'm from South Carolina, and I'm going back to see family members that are a little bit sick down there. And unfortunately, because of COVID, when you got a family member is sick and you want to see them, you need to see them before, because things happen fast around with COVID. So in any case, those are the I think that covers most of the questions that you had. So yes, you can travel, but again, social distancing, washing your hands, wearing a mask, all of those are going to be critically important, even though you have had all the shots.
Okay, thank you. Alice, I'm going to turn it over to you now. Do you have a question?
Yes,
Dr.
yes,
Simmons?
Dr. Simmons. I have a couple questions since you're talking about the mask. Are the masks, are they effective? And how often should you change your mask? Because a lot of people are concerned about the carbon dioxide levels increasing in people wearing masks for long periods of time. So how often should we change our mask? And how effective are the masks?
It depends on what kind of mask you're using in the hospital. I use an N95 mask, which is supposed to be among the most effective masks that they have. But even if you're just wearing a regular mask or a cloth mask and so forth, those two can be very effective because it's the droplet nuclei. It's the sputum, the little droplets that you spread when you're talking and so forth. Those are the things that the COVID rides on. And when you put a mask there of any sort, that's going to diminish the amount of those that are coming from you, and diminishing the ones that are coming toward you. So any kind of mask. If you have a mask that you've worn to the point where it is wet, really wet, I'd change it, because it's decreasing its effectiveness significantly when you have that. So I can't tell you amount of time to wear it, but if you happen to have a mask that seems to that you've used and that have gotten quite moist, I would definitely say that would be a good time to switch to another mask.
Yes, yes.
Mm-hmm.
Now, we understand that there are about 9 different variants of the virus.
Absolutely.
So is that true? If so, which ones do you see the most, and which one is most deadly?
There's actually more than 9. There are, they classify viruses in several different ways. They classify them whether they are a virus of concern, and those are the ones that they feel that can be spread very rapidly. And then they have viruses that are one classification beyond that, and those are the ones that the vaccine might not help very much. And then there's minor ones that doesn't seem to spread very much. There are a lot of the ones that doesn't seem to spread very much, or have gone to other countries and have not come to the United States, that we don't even get to hear of, because all of these viruses are named just like the tornadoes that you see the weatherman talk about. Every time there's a new one, it's the next letter in the alphabet, and so it's a name, it starts the next letter in the alphabet. That's the same way that they've been doing with these viruses, but they've been doing like alpha, delta, this, they've been doing it through a Greek alphabet instead. And so when we're at Omicron now, that's about 14 or 15 letters down the line. So we haven't seen many of the other ones. There have been specific viruses that have shown up specifically in Africa and in Asia, India. There are ones that are in South America and Brazil. There are ones that are in all parts of the country that may not ever come to us, but the ones that do come to us have been viruses of concern. They are ones that spread easily and sometimes can cause a loss of life. And those are the ones that they have. And so they are concerned about Omicron. Now, you got to understand, if you look at not just the States, but other parts of the world, there is no report of anybody dying from Omicron yet. So I've been following that very closely, and I have not been able, at least I haven't been able to find any deaths associated with it yet. However, it is so different from the others that they are concerned that that the percentage of effectiveness that it will have to the vaccine might be very, very low. And that's why they're calling it of concern, because it is definitely depending on what it does, and the manifestations are different. It's not a lung disease. It's not. People get a really bad headache. People get some light viral symptoms, flu-like symptoms, and so forth from the Omicron. And there hasn't been a lot of people that have had major problems, but the ones who have had problems are oftentimes the unvaccinated people that tends to have more problems with that and any other kind of form of the virus. So the unvaccinated patients, especially unvaccinated patients who have coexisting diseases, can tend to have a worse bout of any disease. That's why I'm saying that if you choose not to get a shot, you need to fortify your immune system as much as you can. I can't give you doses of vitamin C, the vitamin D3, zinc, selenium, those kinds, but those are the kinds of things that you need to take every day in your system to try to fortify it, to try to help yourself so that you can be not an easy target, so to speak,
Okay.
for
Well,
these
we
viruses.
have another caller on the line.
Yes,
Yep.
we do. Okay, James. Hello, James. How are you this evening?
Oh, fine. I'm enjoying the show, by the way. And I
Thank
just
you.
have a question. I'm thinking about getting the shot, but I'm overweight and I have blood clot problems. Is there any danger? I want to hang up and listen. Thank you.
I am. I applaud your decision that you want to get the shot. However, I have to tell you that there are some circumstances where, depending on which shot that you're talking about, there are incidences where blood clots have been noted from the vaccine. So I'm not going to stand here or sit here and tell you that there's absolutely no chance of there being a problem. You need to go to your doctor. You need to go and have whatever medical circumstances it is that's causing your blood disorder evaluated, and have that person who has laid eyes on you give you a better answer as to whether you this is a situation of concern where you might want to stay away from it, or whether there shouldn't be a problem with taking that. So I would say you need to go and get an evaluation. I would also, again, recommend that you try to fortify your immune system as well. Find out if there's any kind of medicines that they recommend to you for your blood disorder, whether you need to be on an anticoagulant, whether there's some problem like that. But I definitely say that before you get that shot, you need to go and get your doctor to take a look at you and do whatever is necessary to make sure that you are as safe as possible. Because indeed, some if you're talking about the Johnson & Johnson one and so forth, there has been people that have had some blood clotting issues associated with that. And so I want to caution you by telling you to go and see your doctor first. Okay?
Okay. Right, thank you. Dr. Simmons, there's a couple more questions, and we only have about 10 minutes left.
Mhm.
One of the questions that I have is, what about the flu shot? Should we also be getting the flu shot? And I've also heard that there's a third shot. What is the third shot? And what about the booster shot?
Okay. When people have immune system diseases like MS and diseases like that, where their immune system is significantly deficient, or they have recommended that third shot, which is basically an additional one just to try to boost their immune system, and they've done that. Now and so not everybody requires that third shot, but if you have someone who has medical problems, that is some type of immune disease, that might be a person, an elderly person, that might be someone who is definitely a candidate for that third shot. Now, in addition, there is the booster. And that booster is a smaller amount of the vaccine given as a booster, just to increase the effectiveness of the amount of immunoglobulins that you might have created, and how effective that you are in fighting the flu or fighting COVID. So that's because the way that this particular vaccine works, this mRNA, it tries to stimulate a production of a certain proteins. Those proteins are identical or similar to the ones that are on the surface of the COVID-19. And so instead of exposing you to COVID-19 or exposing you to the whole or dead virus like you've done in the past, they are taking a packet of information. That information will, once it gets into the cell, will go to the DNA, and it will create proteins. And these proteins are similar to the proteins that are on the surface of the virus, and that is going to trigger the formation of antibodies to those proteins, and that will provide you with some protection. But this whole process kind of dies out in about a month. And so that's where the booster is coming, because even after the second shot, it starts to wane and dies out again. So I don't know if there's going to be a booster to the booster or things like that, but I'm just saying that it's not, this particular technique is not a long-term solution. And that's why they have either coming up with a new vaccine or coming up with another round of vaccines that you may have to get at some point in the future.
Now, Dr. Simmons, are there tests that can be given to determine if you've been exposed? Because what happens if you have the COVID, if you have the disease, when you get the vaccine and you don't know you have it? Because they don't test you to see if you have it before they give you the vaccine.
Well, most times they don't want to give you a vaccine when you're actively involved in a COVID event. So that's why they ask a series of questions at the testing site. They want to know if you've had a fever. They want to know if you got this cough, if you're feeling run down, if you have some lung or lung disease. They go through primarily the symptoms that you would manifest if you had an active disease going on, and they have to make sure that you don't have it before they go ahead and give you the shot, because there is a with people that have been diagnosed with COVID, they have to, they generally wait a month or so after they have recuperated from it before they will even allow them to have the shot. So they tend not to want to give you the vaccine at a time when you're actively going through an event. Okay.
Now, should pregnant women get the vaccine?
That's a really controversial one. There are some people that say that that's not a problem. It depends, because when you are during the first trimester, because it's 9 months, so that first segment of that 9 month period, that's when the baby when they're making putting together the DNA to create the child. And that's why as an anesthesiologist and critical care doc, we don't give certain medicines to pregnant women in that time frame, because they are able to create a problem with the child. And that problem is because you can get mutations associated with exposure to certain things. Take, for instance, that's why if we can at all put it off, if a pregnant woman comes in that first trimester and they want to have elective surgery, we will talk with their surgeons and we will talk with the private doc and say, let's put this off for a while. Unless it's an emergency situation, then we'll go ahead and do what we have to do. But if it's an elective situation, we don't want to expose the child to drugs that can cause mutations to occur. The same thing with the COVID vaccine. The COVID, I call it a vaccine, and everyone else does too, but it's actually the COVID is messenger mRNA that carries a packet of information that makes your body create the amino creates the antibodies. And so,
Well, Dr. Simmons, I'm sorry I have to interrupt, but this show could have gone on for 2 hours, not one.
Well,
I mean, there's so much
we'll have to have
information.
you come back.
And we'll have to have you come back again
Yes.
with more information, but we do need to wrap up. Thank you so much for coming out today
All right.
and sharing the information with us. Thank everyone who came out and spent time being with us today, and the questions were fantastic. We want to remind you that COVID's real. As Dr. Simmons
Absolutely.
just told us, it's real. So we need to take it in mind, keep getting the vaccinations if you can, consider it. Make sure you're washing your hands, do what you need to do to protect yourself, and wear that mask. Protect yourself,
Yeah.
protect everybody else.
Mhm.
Thank you once again for coming out. We'd like to thank everybody for tuning in. And remember, our live programs air the first Friday of every month at 6 o'clock. Remember, get vaccinated, wash your hands, take care of each other, and take care of yourself. Thank you so very much. Have a
Absolutely.
great evening, everybody. And Merry
you so much.
Christmas.
Merry Christmas.